today. We'll examine the cancers most frequently seen in older adults. The subject grows more urgent as the population gets older. More than 2/3 of new cancer diagnoses occur in people 60 and above, and the median age at diagnosis is 66. That is why increasing awareness among seniors matters. Aging raises risk because of cumulative exposure to harmful agents and a gradually weakening immune system. When conditions such as diabetes or heart disease are present, care becomes more complicated in older patients. Detecting disease early can save lives. We will point out the major warning signs and note that cancer can present differently in seniors. Treatment decisions are not dictated by age alone. They depend on overall health mobility and personal priorities. Modern oncology is more individualized than ever, aiming to protect both survival and quality of life. In this video, we will cover the leading cancers in seniors along with risks, symptoms, and available treatments, so you stay informed and ready. Let's begin. 6. Colorectal cancer. Colorectal cancer is among the most frequent malignancies in older adults worldwide, with incidence climbing steadily after age 50. By 70, the risk rises markedly, making this a major concern for seniors. The disease originates in the colon or rectum and often begins as a small benign polyp that can gradually transform into cancer. Aging introduces multiple vulnerabilities in the colorectal tract. Decades of exposure to dietary carcinogens, cumulative injury from inflammation, and age-related shifts in the intestinal microbiome all contribute to risk. At the same time, the body's protective systems, those that repair DNA damage and eliminate abnormal cells, become less efficient with advancing age. Recognizing symptoms can lead to earlier diagnosis and improved outcomes. Persistent changes in bowel habits, ongoing diarrhea, constipation, or stools that become narrower are key warning signs. If such changes last more than a few weeks, they should prompt medical evaluation rather than self-treatment with over-the-counter products. Rectal bleeding or blood mixed with stool, even when minimal or intermittent, should not be written off as hemorrhoids in older adults. While hemorrhoids are common, bleeding requires proper assessment to exclude cancer. Dark tarry stools may point to bleeding higher up in the digestive tract, and likewise need prompt attention. Abdominal discomfort, frequent gas pains, bloating, or cramping can signal colorectal disease in seniors. Other concerning features include unexplained weight loss fatigue, or the sense that the bowel does not empty completely after a movement. Some older patients also report a lingering feeling of abdominal fullness, even after several hours without eating. Diagnosis typically involves colonoscopy, with biopsy complemented by imaging, such as CT scans, to evaluate spread. In older adults, clinicians weigh coexisting medical conditions and functional status when planning the workup. Then treatment approaches have evolved to meet seniors' needs. For localized tumors, surgery remains the cornerstone, with minimally invasive techniques often used to support faster recovery. More advanced disease may be treated with chemotherapy, frequently with dose adjustments, and targeted therapies designed to control cancer while limiting side effects. Throughout quality of life and preservation of function are central goals in care planning. 5. Prostate cancer. Prostate cancer is among the most frequent cancers in older men, with over half of diagnoses occurring in those 75 and above. This strong age association reflects changes within the prostate, a gland that produces seminal fluid to nourish and transport sperm that make it more susceptible to malignant transformation over time. The link between aging and risk is driven by several biological processes. Genetic mutations accumulate across decades. Hormone levels shift, and chronic inflammatory changes can develop, all of which increase the likelihood of cancer. By around age 80, autopsy studies suggest many men harbor cancer cells in the prostate, although a substantial portion of these never evolve into clinically important disease. Unlike many malignancies, early prostate cancer seldom causes obvious symptoms. Today, most cases are identified through prostate-specific antigen blood testing before any complaints arise, a shift that has reshaped how and when the disease is diagnosed, particularly in older men who might otherwise have gone undetected. When symptoms do appear, they usually stem from tumor growth, narrowing the urethra, or irritating nearby structures. Signs that merit evaluation include frequent urination, especially at night trouble, initiating or stopping the stream weak or stop and start flow, and burning with urination. In more advanced cases, some men notice blood in urine or semen. Painful ejaculation or aching in the pelvis, lower back or upper thighs can develop as disease progresses. Erectile dysfunction, which has many potential causes in older men, may at times result from tumor effects on surrounding nerves. Assessment typically begins with a PSA test and a digital rectal examination. If either is abnormal, clinicians often proceed to imaging, such as MRI, and a targeted biopsy to refine accuracy and limit unnecessary procedures, an approach that can be especially helpful for seniors. For many older men with low-risk disease, active surveillance with regular monitoring is favored to preserve quality of life. When intervention is indicated, choices include surgery frequently with robotic assistance, external beam or internal radiation, and for advanced disease hormone therapy. Newer agents have improved control of metastatic cancer while aiming to maintain day-to-day functioning and well-being for breast cancer. Breast cancer becomes far more common with advancing age, making it a major health issue for older women. Data show that women 65 and above face an incidence about 1.7 times higher than those 45 to 64, and roughly 10 times higher than women under 45. These figures make clear why breast health vigilance should continue throughout life, including the senior years. Multiple biological processes link aging to higher risk. Cumulative exposure to estrogen over decades, the gradual buildup of DNA damage from environmental factors, and age-related remodeling of breast tissue all increase susceptibility. At the same time, the immune system weakens with age, reducing the body's capacity to recognize and clear abnormal cells before they progress. Recognizing early warning signs can lead to earlier diagnosis and better outcomes. The most frequent clue is a new lump in the breast or underarm. Not every lump is malignant, but any new mass in an older woman warrants prompt evaluation, whether or not regular screening mammography is ongoing. Changes in the look or feel of the breast can also be important. Swelling, dimpling, puckering, or redness of the skin. Some describe a texture that resembles an orange peel, known medically as peau d'orange. These findings should not be dismissed as simple effects of aging. Nipple-related symptoms deserve attention as well. These include inversion or pulling inward spontaneous discharge crusting or scaling. While pain is more often linked to benign conditions, persistent nipple or breast pain can occasionally signal cancer and should be assessed. For seniors, any ongoing breast symptom should prompt medical review. Experts continue to debate screening strategies in older age. Mammography saves lives, but the balance of benefits and risks shifts as people grow older. Many guidelines advise continuing mammography through about age 75 for women in good health, with decisions beyond that tailored to life expectancy and personal values. Diagnosis follows familiar steps: clinical examination and imaging, then biopsy to confirm. Imaging also helps evaluate the extent of disease before planning therapy. Treatment may involve lumpectomy or mastectomy with reconstruction available. For older patients, choices often weigh quality of life alongside survival goals. Most cancers in this group are estrogen receptor positive, making endocrine therapies such as tamoxifen or aromatase inhibitors are effective and often better tolerated than traditional chemotherapy. 3. Pancreatic cancer. Pancreatic cancer is among the most difficult cancers seen in older adults, with the majority of diagnoses occurring at age 65 and above. The disease arises in the pancreas, the organ that supplies digestive enzymes and hormones such as insulin to regulate blood sugar. Its tendency to remain unnoticed until it is far advanced makes it especially dangerous for seniors. Age heightens susceptibility through several pathways. Decades of exposure to carcinogens, the gradual buildup of genetic alterations, and age-related changes in pancreatic tissue all increase vulnerability. Conditions that are more frequent later in life, long-standing diabetes, chronic pancreatitis, and obesity further elevate risk in this group. Finding the disease early is notoriously hard because symptoms usually appear only after significant progression. When complaints do surface, they are often nonspecific and easily mistaken for ailments commonly seen in older adults. This diagnostic ambiguity helps explain why many cases are discovered at advanced stages when options narrow. A notable early clue is the sudden development of diabetes in an older person with no prior history. When new-onset diabetes appears in a senior, particularly alongside weight loss, despite normal or reduced appetite, clinicians should consider evaluation for pancreatic cancer. Tumor growth can disrupt the pancreas's capacity to produce insulin, creating this link. Jaundice, yellowing of the skin and eyes, is another urgent warning sign. It arises when a tumor blocks the bile duct, preventing bile from reaching the intestine. The resulting accumulation of bilirubin in the blood produces the characteristic yellow coloration. Other concerning features include unexplained weight loss, poor appetite, and altered taste or smell. Pale clay-colored stools may reflect bile duct obstruction, while dark tarry stools can point to bleeding somewhere in the digestive tract. Persistent pain in the upper abdomen that radiates to the back is also worrisome. Some patients report itchiness of the hands and feet due to bile salt deposition in tissues. Fatigue, depressed mood, and blood clots can develop as the illness advances. In older patients, these issues may be wrongly attributed to aging rather than investigated as possible cancer indicators. Evaluation typically begins with imaging CT scan, MRI, or endoscopic ultrasound to identify a mass and assess spread. A tissue biopsy confirms the diagnosis, though obtaining a sample can be technically challenging because the pancreas sits deep within the abdomen. Therapy in seniors must balance potential benefit with risk and quality of life. Surgery offers the only chance for cure, yet it may be inappropriate for frail patients or those with advanced disease. Improvements in technique have made operations safer for some older candidates. When surgery is not feasible, care focuses on prolonging life and easing symptoms. Modern chemotherapy regimens are increasingly individualized for older adults, and radiation, sometimes combined with chemotherapy, can help control disease and relieve discomfort. Across all choices, the goal is to match treatment to the patient's overall health preferences and functional status. 2. Lung cancer. Lung cancer is among the most common and lethal cancers in older adults worldwide. More than 80% of cases arise in people aged 60 or above, which makes it largely a disease of later life, and a priority for seniors and their clinicians. Several forces drive this pattern, with tobacco exposure standing out as the dominant contributor. Many members of today's older generations began smoking when it was widely accepted, and the risks were underappreciated, and decades of smoke injure lung tissue in ways that can ultimately become malignant. Risk persists even in lifelong non-smokers. Long-term exposure to secondhand smoke, radon asbestos, urban air pollution, and other environmental carcinogens can accumulate over the years. When these exposures intersect with age-related changes in lung structure and repair, the stage is set for cancer to emerge in the senior years. The early signs can be muted, then grow more obvious as disease advances. A cough that lingers, worsens, or changes character warrants evaluation, particularly in current or former smokers. Chest pain that intensifies with deep breaths, coughing, or laughter should not be dismissed as a normal part of aging. Coughing up blood even in small streaks is a red flag that demands prompt medical attention. New or progressive shortness of breath with light activity may represent cancer rather than deconditioning. Recurrent or slow-to-clear respiratory infections such as bronchitis or pneumonia can signal an underlying tumor. Older adults may chalk up fatigue, unintended weight loss, or poor appetite to getting older, but these systemic symptoms can reflect a lung malignancy. Hoarseness of voice, swelling of the face, or new shoulder or arm pain can indicate spread or pressure on nearby structures. Outcomes improve when cancer is found sooner, including in seniors. Low-dose CT screening is recommended for high-risk groups and can detect tumors earlier than standard chest radiography. Diagnosis relies on imaging coupled with tissue sampling, with the approach tailored to tumor location and patient fitness. Options include bronchoscopy, percutaneous needle biopsy, and surgical excision. Treatment choices have expanded for older patients. Early-stage disease is often managed surgically, and minimally invasive techniques can aid recovery. Stereotactic body radiotherapy provides a non-operative alternative for select cases. For advanced disease, targeted therapies and immunotherapies offer effective and frequently better tolerated options than traditional chemotherapy. Across all stages, decisions emphasize not only cancer control, but also quality of life, functional status, and personal goals. 1. Bladder cancer. Among older adults, especially men, bladder cancer stands out as a major concern. Over 70% of cases occur in males between 50 and 80, a figure that underscores why paying attention to bladder health becomes more important with age. The bladder is a hollow reservoir in the lower abdomen that stores urine, and over the years, it is repeatedly bathed in substances filtered by the kidneys. That continued contact with concentrated carcinogens can injure the protective lining, helping explain why this disease is far more common later in life. Spotting early clues is essential. Frequent urination and a burning sensation while passing urine are among the most typical complaints. The appearance of blood in the urine, even if it comes and goes or causes no pain, should never be dismissed, as it is a classic hallmark of bladder cancer. Older individuals and their caregivers should also watch for pelvic discomfort, a visibly distended bladder, and episodes of urgent need to urinate that result in only minimal output. These problems can erode day-to-day quality of life and warrant prompt medical assessment. Risk does not rest on age and sex alone. Cigarette smoking is the leading driver, accounting for roughly half of all cases. Chemicals from tobacco smoke enter the bloodstream, are filtered by the kidneys, and then wash over the bladder lining, causing cumulative damage. Long-standing inflammation of the bladder, whether from recurrent urinary tract infections or prolonged catheter use, may further elevate risk in seniors. Although uncommon in developed nations, certain parasitic infections contribute to the global burden. Specific medicines have also been implicated, including the diabetes drug, pioglitazone, and chemotherapy agents such as cyclophosphamide. The diagnostic workup usually begins with urinalysis to look for blood and other abnormalities. The definitive test is cystoscopy, in which a clinician directly inspects the bladder lining. Any suspicious patches can be sampled during the same procedure, allowing a biopsy to confirm the presence of cancer. Management is tailored to both the stage of the tumor and the patient's overall health. When the cancer is confined to the inner layers of the bladder, transurethral resection, followed by intravesical therapy, is often highly effective. More advanced disease may call for a radical cystectomy, removal of the bladder, or combined approaches using chemotherapy and radiation. In older patients, treatment planning balances cancer control with functional status, comorbid conditions, and personal goals to achieve the best possible outcomes. Aging does not have to mean surrendering your health. The cancers that most often affect older adults, bladder, lung, pancreatic, breast, prostate, colorectal, and skin, share a common story of lifelong exposures and age-related changes, but they also share a powerful counterpoint. Early attention saves lives. Know the warning signs, listen to what your body is telling you, and have honest conversations with your clinician about the screenings that fit your history and goals. Modern care is increasingly personalized, aiming not only to extend life, but to protect independence, comfort, and the activities you love. If this overview helped you feel more informed and prepared, please subscribe to the channel, turn on notifications, and share this video with someone who could benefit. Your support helps us create more clear, practical health guides for seniors and their families. Stay vigilant, stay proactive, and stay well.